reform is a huge unknown right now that we're all trying to figure out. As we know, there's been about $1 billion set aside for comparative effectiveness research. And unfortunately, personally, I'm a little bit skeptical on what that means. Managed care is famous for asking for head-to-head studies, for example. We're always trying to compare agents, and even despite having, if we don't have head-to-head studies, as formulary managers, we are still making comparisons across trials. So it's important, and it's going to be nice if we can get comparative effectiveness research. My concerns and hopes, I guess, would be that these studies are appropriately designed, first of all. For example, would be if a drug is set up as a non-inferiority trial, that still does not help us make formulary decisions. Because it's my impression that the government has actually come out and said that the intent of this is not to use it to make formulary decisions. My second concern is that this is not going to include any type of cost analysis. And in my opinion, I would rather see cost efficacy or a value analysis rather than just what is considered comparative effectiveness. Because an example there would be if a drug comes out and it's shown to be marginally superior to another drug, but it costs 10 times more, is that worth it? Is that of quote-unquote value to the health plan? So I think if we can get to the point where the studies are appropriately designed and potentially can include superiority, and they include cost issues, and we're able to use them to make determinations of value between medications, then it will be important. Otherwise, managed care is still going to struggle with the results, and are still going to be able to use other things like cost to find holes in this type of data to make decisions.